The World Health Organization has declared that a fast-spreading new variant of the highly infectious disease Mpox is a global health emergency.
In our Health Watch this morning, there are growing concerns over an outbreak of Mpox, formerly known as monkeypox.
On 14th August, the WHO declared the Mpox outbreak in Africa a global health emergency. Though Mpox has been around for years now and there have been previous outbreaks, the concern is that this one is a more deadly variant which spreads faster. Now, cases have been reported in other countries including Sweden and Pakistan. While the Health Ministry hasn't ruled out a few imported cases being detected in India in the coming weeks, it says that a risk of a large outbreak, at least for India right now, is currently low. However, they're keeping an eye on travelers, and airport units have been sensitized and labs are gearing up for detecting, isolating and managing Mpox cases. Even the WHO agrees that sealing borders is not necessary. But people are obviously worried. There are many who need to travel, say for business or other personal reasons. So how can these people protect themselves? To understand that, let's first look at who's most susceptible.
So those people who are above 45, they are almost immune. And even if they get infection, it will be very, very mild. But those people which are below 45 and above 20, which are sexually active, because it is a almost 100% sexually transmitted infection. In that case, these people are at risk.
So if you're in this category and need to travel, then what can you do?
So if you see the advisory, you will find the sexual contact as a last, whereas that should be the first. So people should avoid sexual contact with unknown people. If at all we have use protection. When you travel, you see that you don't rub against somebody who has already got a pox mark. That's it. No other advisory is required. And when they come back, and in the previous kind of infection in 22 to 23, they could prevent a lot of infection by vaccinating those people which are at risk with smallpox vaccine. Smallpox vaccine is now available as a modified Vaccinia Ankara (MVA) from Bavarian Nordic. And they have changed their brand name in different countries. It's called Joinos in USA. If that vaccine is given, that will prevent monkeypox or Mpox. And even if somebody gets symptoms of Mpox, and within 3 to 5 days you start the vaccine, it will also act as a treatment. So Mpox vaccine can be prevention as well as treatment. There are no other treatments available. One is available called Ticovirimat. It has help. So that can be used during that period. What is treatment is required is only symptomatic care and symptoms of treatment of complications. Beyond that, this is nothing. Is not very lethal, very fatal. Only in the endemic that 1A, that is more fatal. Where there is a death rate of 3.6% something. But outside, which is sexual transmission, there are hardly any deaths. And in the previous episode also, we had only 0.4% of deaths among 1 lakh people who were infected.
Since the beginning of 2022, India has recorded 30 cases of Mpox, but no cases have been recorded during the current outbreak of the clade 1 variant. In fact, the case detected in Pakistan also has turned out to be of the older, milder variant, which was clade 2. According to Dr. Gilada, one thing is clear: Mpox will not become like COVID-19.
Mpox will not become COVID. It will not even be 5 or 10% of COVID emergency. Mpox will be limited to those people who are male 6 with male, bisexual or multiple sexual contacts. And it will be in the age group of 20 to 45.
But considering its spreading, what can India and the world do to ensure that they're ready to fight off the virus?
So what we are expecting that Indian companies will come forward, particularly Serum Institute of India, because they have used MVA platform earlier, and they should manufacture the vaccine, keep it ready. The government should buy some amount and stockpile, because without such guarantee, the manufacturers will not produce, otherwise there will be losses. And also use this as a again vaccine Maitri program for the African countries, because African countries requirement is very high. Around they are requesting around 3 million doses now in DRC Congo itself, and America has offered only 50,000 doses. And many of such rich countries, they have stockpiled the vaccine. America itself has more than 1.5 million vaccine which is stockpiled. And there is no threat there immediately, but they are not giving the vaccine to Africa. So what people should think, that helping Africa is helping yourself. You are not helping Africa. You are trying to contain the infection in Africa itself so that it doesn't go out. And that is not happening. And that's the reason that we keep on seeing a lot of outbreak of diseases coming from Africa to other countries. Only when you get into some problem, then you start doing R&D and produce something for yourself. and stockpiling, that is not going to be a solution for global health.
Hope you found this video useful. For more such content,